So how do you fix a hole in someone's esophagus without surgery? Well, first you have to diagnose it. We had a patient with a recent diagnosis of cancer report that he had coughing and choking immediately after he ate or drank anything. That's pretty unusual, so we did a special video x-ray of his swallowing to check it out. You can see his esophagus or food pipe with some black liquid sitting in it. Down and left from there is the air pipe or the trachea. The mesh object you can see is a stent in the trachea that was placed there for his cancer. Now the fluid suddenly moves from his food pipe into the air pipe and down into the lungs. That's very unusual and it causes coughing, choking, and serious pneumonia. So to figure out what's going on, we did an EGD that lets us put a camera down into the food pipe to check it out. This is the esophagus, and as we move upward towards the mouth, there's actually two abnormal holes or fistulas that definitely shouldn't be there. This is from the patient's cancer. You could fix this with surgery, but that's a high-risk procedure, so we're going to do it using tools through our camera. First, we use a device to burn the edges of the holes to make them more likely to stick together and heal once we clip them. Then we place metal clips to close the holes, a big clip for the big hole and a little clip for the little hole. Then, as an extra layer of protection, we place the metal stent with plastic covering over the clipped holes to prevent any leakage. Lastly, we stitch the stent into place so it doesn't move. All of this without any surgery or incisions.